Medical news. Nearly 30 million Americans have experienced migraine headaches, and more than 7 million have pain so severe they've sought professional help. But now there's new hope for many sufferers. ABC's Andrea Canning has more.
54-year-old Bonnie Muir has lived with paralyzing migraine headaches since she was a teenager.
It feels like a 10-penny nail boring through your temple.
At times her headaches and the nausea that follows are so unbearable, she dunks her head into a sink full of ice to dull the pain.
If the headache is bad, you can't do anything. I mean, dark room, shades drawn, no sound. You take your medication. Sometimes the medication just doesn't work.
Muir was missing work and social opportunities until hope came in an article she read in her Hoboken, New Jersey newspaper. A simple nasal surgery that could possibly relieve her headaches.
Good luck. If this is a breakthrough for migraine, hers will be much, much less than what she had before.
Ear, nose, and throat specialist Dr. Behin says some migraine sufferers, like Muir, have pressure points in their nose called contact points that he believes can trigger the debilitating headaches.
Separating it.
Behin uses surgery to eliminate Muir's nasal pressure by separating the bones, pressing on the septum.
We can see that the septum in this cut is completely separated from both walls of the nasal cavity.
What I'm hoping is that the surgery will find the contact point is actually causing or triggering many of her headaches. And by removing the contact point, we're going to be able to lessen the frequency of her headaches. I'm going to pull, resist.
Nearly 3 months have passed and the surgery appears to be a success. For Bonnie, life has already dramatically improved for the better.
I couldn't drink wine, I couldn't eat chocolate, and, you know, I've done both with no ill effects since the surgery.
For the first time in 40 years, she doesn't live in fear of her headaches.
I'm free. It's sort of given me a new sense of freedom and mobility that I haven't had pretty much all my adult life.
For Good Morning America, Andrea Canning, ABC News, New York.
And we're joined now by Dr. Nancy Snyderman, Vice President with Johnson & Johnson and ear, nose, and throat surgeon herself. Doctor, good to see you. What do you make of this? Of those 7 million people who seek treatment each year in this country, how many you think are candidates for something like this?
It's hard to tell how many are candidates because I think we're still learning a lot now, trying to differentiate migraine sufferers from the classic sinus pain headache person. So the real interesting thing is, can you take surgery that's been around for 15 or 20 years? It's basically called endoscopic sinus surgery. And are we looking at a new indication for it? And I think there probably is a small subset of people who could benefit from this. And I say a small subset because I don't want to throw this out saying, oh boy, it's a panacea now for migraine sufferers. Go throw your headache medicines away. I don't think that's the case. So I think patients are going to have to really do their homework. Do you have pain that has not been responsive to medicine? Do you have a good ear, nose, and throat doctor in your community who does this kind of surgery? And then have you had a CT scan of your sinuses, which basically is going to see, do you have these contact points? Only then should you sit down with the surgeon and say, okay, should we talk about this surgery?
Yeah, if you know anybody who has exhausted every possible resource, every drug, oxygen and everything, I'm sure they'll leap at this. But is there such a thing as a minor sinus surgery?
There's no such thing as a minor surgery. If there were, you'd see surgeons signing up for surgery. No, every surgery comes with a complication, and this surgery, when it goes well, is a piece of cake. But I've seen some horrific complications from it. So the whole point is, if the middle of your nose, the septum, is crooked, and if it's pushing on the side wall of your nose, under one of these pressure points that triggers the nerve, if you straighten that middle part of your nose, the septum, can you relieve the pressure point? And I think in some patients that probably is a trigger, and there probably is a worthwhile indication. But I would caution patients, even if it works, it may mean you still get an occasional migraine. You may just not get them enough. But you have to do your homework. This is not casual surgery. So make sure you find a doctor in your area who does a lot of these. Now, the good thing is insurance does cover this kind of surgery because it's been very well studied for the last 15 or 20 years.
Dr. Snyderman, always great to get your perspective. Thanks.
Thank you, Bill.
Coming up on Good Morning America, when you got to go, got to go. We'll catch up porta potty racers from Lithuania. News you missed is next.